Hi students. So for this lecture, we will talk about three principles in bioethics. The first principle that we will talk about or discuss is your principle of truth telling. If you encountered other terms like principle of veracity, this is still similar to your principle of truth telling. Now, principle of truth telling is a key component to ensure that there is trusting relationship between patients and their healthcare providers. Because in this principle, you try to achieve what is you try to achieve or to reach, no, to establish a truth that is fundamental right of every patient. Now, the principle, when violated, fosters distrust among healthcarers and their patients. And when mistrust gets the better of the relationship, of this professional relationship, your medical protocols, your nursing protocols becomes dubious. Ibig sabihin, whenever you try to smear your communication with lies, with untruthfulness, your whatever you do to your patient will always distrust you. This is important to remember the principle of truth telling because this is the root of nurse-patient relationship. No, you need to establish rapport with your patients, and when you establish rapport with your patients, the core principle that should revolve is the principle of truth telling. Kaya ngayon pa lang, sinasanay na namin kayong magsabi ng totoo. Kasi whenever you are in the hospital and you encountered wrongdoings and you tried to lie, hindi naman kayo ang mapapahamak. Yes, mapapahamak kayo dahil um, in terms of academics, no? Pero mas kawawa ang pasyente ninyo kapag hindi kayo marunong magsabi ng totoo. Kaya notice that whenever we try to correct you, we always ask for what is the truth of what you did. Okay? Because nursing or medicine and lying cannot blend. No? You as a nurse should continuously pursue truth through precise and accurate process. Hindi mo dapat sinusugarcoat, hindi mo dapat pinagtatakpan kung ano man ang dapat sabihin sa iyong pasyente. Okay? Now, communication is an important ingredient, no, to the process of healing and curing. If you do not communicate, no, your expectations, the findings of the patients, no, ng tama, okay, there's no true healing at all. Physically, yes, gumaling siya, pero kung hindi mo sasabihin ng totoo, emotionally speaking, psychologically speaking, and intellectually speaking, hindi siya gumaling. Dahil hindi mo sinabi yung totoo. Now, the goal of principle of truth-telling, no, in professional communication, the first goal is to strive to establish and preserve truth at both the emotional and rational levels. No? Before telling the truth to someone, because lalong-lalo na pagdating sa diagnosis, the initial response, no, of any patient with their diagnosis is that they will deny it. No? The initial response is to deny. This appeals to their emotional aspect or emotional dimension of their personality. You have to preserve the truth, no, even if you want, no, to preserve also the emotional level of that person. So you have to introduce the truth gradually to your patients. Whatever you find out about them, no, that should be told to them, dapat you have to disclose it fully. And if you sense that there is resistance on the part of your patients, then you need to disclose it gradually. Okay. Next, when when observing the principle of truth-telling, you also have to share only the information which is legitimately needed by others in order to have an informed consent. This means that any information that you give to your patient, okay, should be said in full. Kailangan ang information buong-buo na maintindihan ng pasyente dahil importante ito sa pagkuha ng informed consent. Informed meaning alam nila kung bakit sila nagko-consent sa isang bagay. So the principle of truth-telling is also important, no? Is a prerequisite when giving or securing an informed consent. The third principle of truth-telling, which is very obvious, is to refrain from lying and giving misinformation. Because when you give lies to your patients, and most especially when you secure consent from them, it leads to an invalid consent. No? Even half-truths are also inappropriate because informed consent requires fullness of truth. Sabi ko nga kanina, when the truth, no, the fullness of truth cannot be accepted immediately, you can divulge it fully by doing it, no, in gradual phase. Dahan-dahan mong ipa-realize sa pasyente na yun ang kanyang kondisyon. Okay? And the next principle of truth telling is the next goal of the principle of truth telling is to not divulge secret information not legitimately needed by others and consequently might harm your patient or others or destroy their trust. No? In principle of truth telling, you are also obliged to keep into your matters, no, any information that pertains to your patient unless it is necessary to save them from greater evil. Okay? So confidential matters should be well kept and handled so that the patient would not unnecessarily be exposed to the public. Now, if you are aware of different practices, no, kadalasan sa advertising, some of these advertisements violate, no, the principle of truth telling. Like for example, those advertisement about formula milk, no? Na kapag sinabing uminom ng ganitong gamot dahil it enhances, no, the potential of your children. Well, there's some lies about it because we all know that breast milk is still best for your babies. So, these advertisements are tinged, no, with lies, no, making it an ethical advertisement. Okay? Another principle that we will discuss is the principle of confidentiality and privacy. Now, confidentiality and privacy is an important principle, no? Which most people or almost all people would hold dearly, no? To keep confidential the information about them and to keep their space private. Pag sinabing confidentiality, this is a principle that concerns in keeping safe the patient's information. Records ng kanyang transactions, records ng mga order ng doktor, records ng kanyang mga medical test or examinations. That's what your principle of confidentiality protects. No? It protects information. On the other hand, when we talk of privacy, this is the protection, no, of your patient's space, no? Space meaning personal space, yung katawan niya, personal space yung bahay niya, no? Yung personal space or any space, no? Social space, whatsoever. Okay? Keeping private your patient's space. Okay? So kaya nga tinatawag natin na kapag in-expose natin unnecessarily yung information ng pasyente, we breach their confidentiality. But when we try to expose, our patient's privacy or expose it to anyone else, we invade their privacy. Okay? Now, why is it so important to protect confidentiality and privacy? Because information attached to your patient and the space they consider their own is part of their dignity. No? If your identity is exposed unnecessarily, you feel you feel degraded, no? Because you know that this is part of your identity, or that space is part of your identity. So therefore, you try to protect your privacy so as to protect your dignity. Now, always remember that the principle of confidentiality and privacy is never absolute. For one, if there is a greater reason or cause, no, if there's a greater reason or cause, you can breach the confidential or private records. Ano-ano yung greater cause na iyon? Ito po siya, no? Ang greater cause na iyon ay kung pumayag yung pasyente, no, na i-expose yung kanyang sarili. Okay? Isa 'yon. Another grave or greater cause, to breach confidentiality uh, is to protect, public safety. For example, there's a pandemic, and you need to inform, no? You need to inform the authorities, for epidemiologic reporting. So, binibreach kahit kakaunti yung confidentiality ng tao by declaring kung saan siya nakatira, no? Para lang mai-report kung yung epidemiology yung pandemic. Okay? So that's one cause to break you or to breach your confidentiality. Another greater cause, to break your confidentiality is when you are answering for a medical legal case. 'Di ba? Kasi sometimes or some cases, more in particular yung mga cases that causes injury, no? Minsan kinakailangan na mag-present ng medical record ng pasyente or ng biktima or medical record ng mga suspect. So it has to be exposed, no? Their confidentiality can be breached, okay? Because we want to resolve, some case. And in line with this, another greater cause for breaking confidentiality is because there are court summons, no? Yung mga subpoena. Kapag ikaw ay sinubpoena, dalawang klase yan, no? It can be subpoena testificandum, wherein you will be summoned in court to testify, for something, or it can be a subpoena duces tecum, or a summon of the records of your patient, or of the hospital, and they will examine the contents of that records, no? So if you have been watching or if you were aware of the case of a law student in UST who was murdered, who was killed in hazing, the 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 victim was rushed to our hospital, no? And if you have been watching the news and if you watch the news during those times, our nurses were summoned during that time. Okay, some of them are our graduates and testified in a Senate hearing. Okay, if you have seen that, and if you have observed that particular testifying in court, there's a breach in confidentiality because the nurse narrates what happened during that time. By principle of confidentiality, sabi nga natin, we cannot disclose that, if not needed. But sabi ko nga kanina, this is never absolute because of greater reasons, and one of that is your court summon. Okay? So what are the subjects of confidentiality? Ano yung mga matters na subject ng pagpoprotect, no, under this principle? The first one is your private secrets, no, or any information pertaining to the personality, personhood, identification ng tao. Private secrets. Ano-ano ang mga ito? Pangalan, okay? Edad, birthday, address, no? Anything that is personal to that person is subject or is a private secret. Next are your contractual secrets. When we say contractual secrets, these are the records of all the transactions of a person, no? All of the transactions, mapa-communication, mapa-bangko, mapa kung ano-ano pa man. Okay? So these are the subject of confidentiality. Okay? Next are your professional secrets. When we say professional secrets, these are, no, the information or anything that transpire between the patient and you as a nurse or the healthcare team, which occurs under a professional relationship. So this covers the information, no, written in your chart, no, in your cardex, in your medex. All of this information are recorded or are part of professional secrets and has to be kept confidential. Okay? So sabi ko nga kanina, these are the causes for breaking confidentiality because it's never absolute. No? So let's have an example. Okay? One of the examples na where we breach, no, where we usually breach or invade the privacy of a person is when we try to video them during their surgery. No? Minsan, sa sobrang tuwa natin sa duty natin, hindi natin napipigilang magpicture ng mga tao, no? Ng mga pasyente, ng mga bata lalo na kapag tayo ay na-assign sa mga institutions, no? Na nag-aalaga sa mga alilang bata or what. Minsan hindi natin mapigilan. Okay? So we have to be careful when we do this because these are when we take pictures of them, that's actually an invasion of their privacy. Okay? That's actually an invasion of your privacy. In research, no, minsan din, when we observe a person, no, nang hindi naman tayo nagpaalam sa kanya, that's already, no, an invasion of their privacy. Pag inoobserbahan mo sila, nire-record mo, no, nagte-take notes ka kung ano yung mga ginagawa nila. That's an invasion of their privacy. Unless pumayag sila. So always remember, the key concept is that you have to ask for consent. Okay? Unless, sabi ko nga, there is greater cause, no? There is greater cause to break the confidentiality or the privacy of the person. Another is the principle or the next principle or the last principle for this lecture video will be about the principle of justice. No? Justice means we allocate or we give a person what is due to him or her. Justice, always remember, justice is not equivalent to equality. Because equality means we give equal chances, we give equal opportunities, we give equal treatment, no, regardless of the situation. Now, the principle of justice is important because we give what is due to a person. No, this is a more acceptable form of distribution of goods because we try to give it, no, to the person who needs it most, no, who has a justification to receive that resource. Now, the principle of justice in healthcare in terms of can be applied in terms of healthcare resources because we all know healthcare resources are always limited, no? And whatever are available should be fairly and rationally allocated so that they can benefit as many people as possible. No? There are several resources no, that we refer in healthcare, which include, number one, manpower, yung mga nurses, doctors, and healthcare providers. The money, which refers to the funds no, that we use to spend for healthcare. The machine refer to the equipment no, and facilities for healthcare. The methodologies, when we say methodologies, the methods, these are the ways no, we try to give to try to give the care to your patients, and the materials no, or the supplies that we use no, in healthcare. Now, there are several paradigms of healthcare allocation. Now, healthcare resource can be allocated in a giga level, no? Which views that healthcare allocation must cut across national boundaries. No? The distribution of the resource at the global level. If you're watching the news, no, there are or reading the news, no, sa mga trusted websites, there are initiatives, no? There are initiatives to distribute, no, the COVID-19 vaccine at the lowest price possible. No? There are some news claiming that they want to sell it for $3 per vial, no? While some other countries are selling it for around I don't know, I think it's around 70 no to $100 per vial, no? If the context of resource allocation is at the international level, that is a giga allocation paradigm. When we talk of the allocation that is national in scope, that's a macro allocation paradigm. So the best example here is how we allocate our healthcare resources, no, for in response for the COVID-19 pandemic here in the Philippines. Okay. Another type of or another paradigm of healthcare resource allocation is what you call your meso allocation, which refers to allocation that is institutional in scope, meaning sa loob ng organization. While micro allocation is referring to your personal allocation of resources. No? Kung healthcare man yan, yung resource mo para sa healthcare. Okay? So this one is the best definition of justice. No? I hope that you will read your lecture notes on this one because this one is self-explanatory. Now, there are also theories no, or models of justice or for the distribution of healthcare resources. No? The first model of justice that we will discuss is what you call your egalitarian model, or which espouses equality for particular categories of or for all living entities. It means they wanted to have equal access to goods and services in health. They do this by making the affluent members of the society no, give or pay more taxes so that those who have less can be accommodated or can receive quality care. So that's the egalitarian model. While the utilitarian model or of justice pursues the view of the greatest good for the greatest number. So it uses methods that seek to distribute healthcare to the good or health goods to the majority. Therefore, it believes that even in times of crisis in healthcare services in the society, no, it must be provided to those who will benefit most. Okay? So this is rooted in utilitarianism, no? Distributing the goods to the greatest number of people for the greatest benefit. Another type of model is what you call your libertarian model, which emphasizes personal right or organizational right to social and economic liberty. So this is a free enterprise approach because those who can avail of good healthcare services can be given that kind of service, and vice versa. No? For those who cannot avail it, no, they will not receive good healthcare. So that's your libertarian model. Libertarian model is can be observed, no, in some policies in healthcare, no? Ano-ano 'yon? Yung health maintenance organizations. Health maintenance organizations will require you to pay a premium, no, so that they will act, no, as a guarantor or as a co-payer or co-payer for your healthcare. Dahil ikaw ay nakakapagbayad ng premium, ikaw ay makakapag-avail ng mas magandang healthcare. Kung wala kang pera, no, you can't avail their services. So that's roughly, no, roughly a personification kung tawagin of a libertarian model in health, in justice or healthcare resource allocation. Another type of model is what you call your distributive justice model, wherein both benefits and risk are equally distributed to all the members of the population. It takes into consideration that everyone must have a right to access healthcare, but he must be willing to make corresponding sacrifices. It means that in this principle of justice, in this distributive model, you have to equally share, no, the burden or the benefits and the burden of such healthcare policy or modality. Another type of another principle of justice or another theory or model of healthcare resource allocation is your social justice model, where we give back to society what we took from it. Primarily, the beneficiaries are the poor. Hence, the poor are given more privileges. Okay? So, binibigyan ng pagkakataon ng mga mahihirap na sila ay magkaroon ng magandang healthcare or makaranas ng o makatanggap ng magandang serbisyo pangkalusugan. While the pragmatic model or the popular model is a type of justice model where it focus on rationalizing the more workable solution or the more fanciful, no, rather than what is necessary. Okay? While the natural law model of healthcare resource allocation, okay, emphasizes that justice must be present in all healthcare activities. If the natural law model, as the name would imply, it will take on, no, the tenets of natural law, no, wherein it will espouse that everyone has their innate dignity. So this natural law model emphasizes that all person, regardless of what they have in life, their social status, their race, their age, or whatsoever, all people are entitled, no, for a quality healthcare. Okay? So here are some other minor models, no, in healthcare resource allocation. The first come first served basis, no? Kung sino yung maunang makapasok, kung sino yung unang nag-avail, siya ang unang bibigyan ng healthcare. Okay? Meron din tayong tinatawag na survivability model, kung saan binibigyan natin ng mas magandang pagkakataon in healthcare yung mga mataas ang chances na mabuhay. Usually, ginagamit itong model of justice na ito sa mass casualty, no? Sa rescue, kapag may mass casualty, inuuna yung mga taong mas magsusurvive, mataas ang chances ng survivability. Another type of model is your social status model. Okay? Even your age of patient or the severity of your disease. Huh? So those are minor models, no, in the allocation of healthcare resources. That ends my lecture for this week. If you have any questions, you can send me a Facebook message. If you want to discuss this over our Facebook group, you may do so and start a discussion post. Okay? So that ends my lecture and have a nice week.